Hello and welcome to Let's Talk on WISR 680 AM. I'm Ryan Saylor, and today I'm joined on the phone by Dr. Brian Donner, Chief Medical Officer and co-founder of Compassionate Certification Centers. Hello and welcome to the show, Dr. Donner.
Hi, Ryan. Thanks for having me. I appreciate it.
Absolutely. I just want to make sure that we're all on the same page to get some definitions here from a medical expert like yourself. Can you tell me and our listeners a little bit about what exactly is CBD, what is THC, and what is the difference between the two?
Absolutely, and this is another common question. And these are called cannabinoids. And what cannabinoids are, they're molecules within the cannabis species of plant, and these are what we would call some of the bioactive molecules in the cannabis species. So THC, we said one, CBD or cannabidiol, that's another one. There's actually over 100 of these cannabinoids in the plant that can have some bioactive properties to them or can have an impact on human physiology. Every human being actually has what's called an endocannabinoid system within their body. And this is a system of receptors and these molecules that bind to these receptors, and then they have a downstream physiological response. Our body makes some of these cannabinoids on their own. These are called endocannabinoids. The cannabinoids that come from the plant, just like THC and CBD, these are called phytocannabinoids, and they're structurally very similar to the internal cannabinoids that our body makes, and they can interact with those receptors within the endocannabinoid system, and that's how they have their therapeutic or medicinal value.
Okay. I've heard tell of CBD that's high quality, and I'm kind of unclear about what kind of factors give CBD high quality, and why is it important that CBD is of high quality?
That's a great question, and I would preface it with that in science, a molecule of CBD is a molecule of CBD. When we discuss that maybe not all CBD is created equally, what we're talking about are the end stream or the downstream final products that patients are consuming. So whenever we talk about this, all products are not lab tested in the same type of way. All products don't have the same combination of different cannabinoids. All products may not have different what's called terpenes, what could be in them, or essential oils. So there's going to be different ratios of cannabinoids, different amounts within the products, and honestly different type of products through what we would call different routes of administration as well. So for example, imagine a CBD product. One may be applied topically versus another one that could be taken orally, right? And they would have different physiological properties for the patients, how they're taking them. So when we talk about when all CBD is not created equally, it's not talking about the individual molecule. It's really talking about the products that are out there today and available to consumers and the differences between those products.
That makes sense. What kind of differences are there between CBD products with THC and without? And are there different uses for or benefits of that are provided by each of those?
So it's a very complicated question, and I'll try to give you the best answer that I can. So technically, by the lay of the law, particularly federal law, products that contain higher than 0.3% of THC are considered federally illegal. That's whenever we get into the state-run medical marijuana program. So for the average consumer or patient that's going to be going out, say, to a pharmacy or maybe down the road to the local gas station or in a apothecary, those type of CBD products are going to have, they're going to be derived from hemp, which by definition, hemp is a species of cannabis that is very high in CBD and very low in THC. In order to be considered legal under federal mandates and regulations, that has to have less than 0.3% of THC in the product. Now, it can be further delineated. Not all products have to have THC in them, or not all CBD products. So, for example, we further break these down to what we call a full-spectrum product, a broad-spectrum product, or an isolate. And really, the difference between these is relatively straightforward. A full-spectrum product is something that has all of the cannabinoids in it and the essential oils in it, basically from that plant, including THC. So things like CBD, THC, CBG, CBN, all these different phytocannabinoids, but a full-spectrum product contains small amounts of THC in it. A broad spectrum product, on the other hand, contains everything that I just mentioned outside of the THC. So in a broad spectrum product, you might have CBD and CBN and CBG, but there will be zero THC. The third and final product is what we call an isolate. And really what an isolate is, it's just what it says. It's an isolated cannabinoid. So you might have a CBD isolate, which means that it would be something along the lines of 99.9% CBD. So it would be CBD alone. So when we talk about full spectrum, broad spectrum, and isolate, those are the rough definitions, and those are relatively common terms that are used in the medical cannabis industry today.
Thank you, Dr. Donner. You're listening to Let's Talk on WISR 680 AM. Dr. Brian Donner is with us, Chief Medical Officer and co-founder of Compassionate Certification Centers. Dr. Donner, you got into this a little bit earlier, but I just wanted to know, how does CBD work inside the body? Does a specific product target a body system or area, or is it more of once the CBD is in the system, it's just drawn to the area that's kind of in need of attention or lacking?
This is a good question, right? And it goes back to what we had spoke about before with the body's internal endocannabinoid system and these series of receptors and then these molecules like CBD that either bind to the receptor or act around that receptor. So similar systems we have in our body that people may have heard of, such as serotonin or dopamine or norepinephrine, they work on a similar system of this biochemical communication. So whenever a person takes CBD, whether it's inhaled or taken orally or topically, that then gets absorbed and it can be distributed into the bloodstream. Once it's into the bloodstream, it is able to interact with the CBD receptors within the endocannabinoid system throughout the body. And then by interacting with the different receptors, either a CB1 or a CB2 receptor, it can have a downstream physiological response, right? So, for example, a patient takes CBD through the oral route. It's processed through the digestive system. It's incorporated into the bloodstream. It's able to then get distributed throughout the body, interact with those endocannabinoid receptors, and one of the downstream responses might be something like inflammation reduction, right? So whenever we talk about these molecules and these medicines, that's how they work, and it's very, very similar to traditional medications and pharmaceuticals.
Excellent. I was doing a little bit of research before this interview, before speaking with you, and I was on the Compassionate Certification Center's website, and I saw that you guys offer a lot of different services. Is it possible for anyone to just walk in and purchase CBD products, or does a person need to have a doctor's appointment first?
And I appreciate you bringing this up because there's a lot of confusion, I think, out there, particularly considering the different regulations and laws in the different states. So to answer your question, yes, anybody is able to come into one of our locations or clinics or go online to our website and purchase CBD. They do not need to have a medical marijuana certification or a card to obtain CBD products on their own. All of our CBD products will contain, if they're a full-spectrum product, they'll contain less than 0.3% of THC. And as we discussed before, if they're a broad-spectrum product or an isolate, they'll contain zero THC. But those are available to anybody out there without any additional certification. Conversely, the medications that you'll find at the dispensaries throughout the state, these all typically are not derived from hemp. They are derived from the female marijuana plant. So by definition, they're most likely going to have a higher level of THC and potentially even a lower level of CBD. In order to obtain one of those type of products from the actual dispensaries in Pennsylvania, that's whenever a patient will have to have a medical marijuana certification based off of one of the qualifying conditions in the state of Pennsylvania.
Let's focus in on the Butler area for a few minutes. The local Compassionate Certification Center's office is located at 127 East Cunningham Street. Tell us about the increased use and popularity of this particular facility, as well as how many people have been helped in our area.
I'm proud to say that our Butler office was really one of our first few offices that we had, and it's still to this day what I would say one of our flagship offices. That not only do we have a high number of patients who come in for their certifications, but from a CBD and product standpoint, we have a lot of our patients who come there consistently, and there's a lot of walk-in traffic based off of where it is. But over the years, I think we have seen well over 6,000 or 7,000 patients at our Butler clinic. Typically, we're seeing hundreds of patients there a month. Our clinic, I like to tell people, it is even on days when we're not seeing patients. Oftentimes, our clinic is open and staffed by our employees. So if you have questions about CBD, how to obtain your medical marijuana certification card or anything at all, you can just walk in. So I feel that really we've become incorporated into the community in Butler, which has been fantastic. And still to this day, it's one of our busiest offices and really sort of serves as I said, one of our flagship locations.
Excellent. You're listening to Let's Talk on WISR 680 AM. I'm Ryan Saylor. I'm joined on the phone today by Dr. Brian Donner, who's taken time out of his busy schedule seeing patients. He's Chief Medical Officer and co-founder of Compassionate Certification Centers. We've all been dealing with the effects of COVID-19 pandemic, and it's affected many aspects of many of our lives. How has Compassionate Certification Centers had to adjust to the current situation and kind of provide help differently?
Yes, we all live in a dramatically different world than we did just 6 months ago, and it's been very difficult for everybody. And with us in particular, I think there's been a few things that we've noticed. The biggest change that we have seen is the transition into telemedicine and having that be available to all of our patients. Prior to the pandemic, that was not telemedicine was not something that was able to be used for medical marijuana certifications and evaluations in the state of Pennsylvania. Secondary to the pandemic and the emergency implementations that have been in place, we have seen just a massive rise in telemedicine appointments. To the point where we're seeing hundreds of more patients a month. And really what this has done is it has made things easier for the patients. We can take some of the anxiety out of coming to the office and having to be potentially in an enclosed space or with exposure to other folks that you don't want to. We're also patients are able to work around their schedule a little bit more easily, whether it be work or childcare. And they typically can do this from the comfort of their own home, and it can be done just as effectively. So I really think from our standpoint and really CCC's business model, that's what we've seen the most dramatic increase since COVID has started. I can tell you that clinically, one of the things that we've seen with a lot of our patients, and it fits in, I would say the rest of probably the global population, is really increased issues with mental illness, what I would call psychological issues, particularly those being anxiety and depression. We have seen anxiety really increase in our patient population during this time and during the pandemic. And CBD and medical cannabis can be really nice treatments, either as alone or as an adjunct when you're talking about things such as anxiety and PTSD. So those are really the two, I would say, main changes that we've seen on our end, obviously with a bunch of other small things changing as the days go by.
You mentioned the telemedicine, and I wanted to get into that a little bit because I think it's really interesting. Tell us a little bit more about the option of those virtual visits. How does it work, and kind of what are the benefits and the pros and cons, and are you seeing more people take advantage of that choice now that it is an option? I
will answer the second part of your question first here, and it's overwhelmingly yes. We are seeing an overwhelming amount of patients really migrate towards that telemedicine platform. And I think there's a number of variables that lead to that. It's not only a phenomenon in medical cannabis, but I think just across the general healthcare landscape. So when we talk about telemedicine or virtual, what does that mean? Essentially what it means is imagine an interaction that would be similar to if you FaceTime somebody on your iPhone or an iPad, or if you had a Zoom meeting where you can basically have a virtual virtual face-to-face interaction with a provider while you're sitting in the comfort of your own home. This could be done from your home computer or laptop or from a tablet such as an iPad, or a lot of people even do this from their phone. What it enables our patients to do is really make things a lot easier. So you could imagine where now I could do this from my own home. I don't need to take time off of work. I don't need to drive into an appointment. I don't need to look for parking. I don't need to sit in an office and wait if anybody is behind. So it's really streamlined things for patients and made it much easier for them. From a technological standpoint, nowadays things are really straightforward. We even see a lot of our elderly patients into their 80s, even some folks in the 90s who are able to use the telemedicine platform without any issues at all. And once they do it, most of our patients say they're so glad that they did because it really makes things easier from their own end personally.
I mentioned the Compassionate Certification Center's website a little bit earlier, and it was evident when I was on that site that your organization is very involved with community outreach efforts. What kind of efforts do you have currently underway, and why is this important to CCC?
So that's something that the CCC really believes in deeply, and it's something that we've been a part of really since our organization's inception. I think when you look at medical cannabis as it's been integrated into healthcare, one of the really neat and interesting things to me is that this was something that's been really patient-driven. It hasn't been driven by doctors or researchers or scientists or big pharma. It's really been driven by patients who are looking for answers, where oftentimes traditional healthcare hasn't met their needs, right? So whenever you have something like this that's such a patient-driven specialty, in my opinion, that's really what helps makes things go. Patients, what we find, Ryan, and just as a general comment, patients are so interested in learning more about medical cannabis so that they can treat themselves better. And an analogy I make to a lot of my patients is that, me as the physician with medical cannabis, I'm putting some more tools in your toolbox so that you're able to then better treat yourself. And I think, generally speaking, the paradigm of medicine is shifting that way towards individualized medicine. So cannabis fits right in that paradigm and sort of where I in particular believe things are going.
I wanted to ask you about, after that big buildup that the state of Pennsylvania had, we've now had a couple of years of medical marijuana use in our state. How do you think that Pennsylvania is handling the medical marijuana program? Did it do a good enough job at first? Is it kind of flexible enough to adjust to necessary changes at this point? Or what is your view of the program at this point?
I'll tell you this, my overall view of the PA program is very positive, and I've seen other states and I've seen how things can go. And overall, Pennsylvania, in my opinion, has done an excellent job. They've been able to really be fluid and adjust on the fly. You can look back from in the past whenever initially the flower products weren't available, that was able to get changed and updated. They were able to be very proactive in conditions such as adding opiate addiction or substitution therapy, and then even most recently by adding anxiety as a qualifying condition. I think at first the state ran into a problem with supply and products, which is pretty common in most of these state programs. But since that time, with the different phases of the new grow operations and the dispensaries, I think we've addressed that as well too. The research, the dedication to research that Pennsylvania put into their program, I think is a tremendous idea. I know they hit some roadblocks from the start, but that is even moving forward now in the right direction. So overall, I think Pennsylvania has been very successful, and I can tell you this, Pennsylvania has had a very robust cannabis program whenever you look at it and define it by patient participation. So overall, I think Pennsylvania's done a really nice job.
What kind of advice, if any, would you give to state health officials or suggestions of changes that you would recommend being made to the medical marijuana program in Pennsylvania?
This is a great question, and I appreciate you asking this. So one of the biggest problems that I see in the Pennsylvania cannabis program is that there oftentimes is a disconnect between the different providers and the patient. So, for example, the certifying physician versus the patient versus the dispensing pharmacy. There's really not a lot of communication that happens now, in particular, between the dispensing pharmacy and the certifying physician. And I think this is a problem because ultimately then you ask, well, who is responsible for the patient's medication regimen and outlining that? The reason it's set up this way, I think, is because of federal legislation. However, I think moving forward in the future, physicians need to be able to take a bigger part in their patients' medications, where that it's not only me as a doctor saying, okay, here, you're certified for medical marijuana, but really, a physician who's specializing, who understands cannabis, should be able to outline a treatment program and plan and put that together in conjunction with the other providers, such as the pharmacist, to ensure that plan is being instituted. I think our state, that's one area that we lack. The good news is there are some software technology companies out there, things that are in place in other states that can be integrated to make that better, and I have a feeling that will absolutely help over time.
Thank you, Dr. Donner. That makes a lot of sense. Dr. Brian Donner is my guest today. He's Chief Medical Officer and co-founder of Compassionate Certification Centers, located many places around the western Pennsylvania area, including right here in Butler at 127 East Cunningham Street. I'd like to give you the opportunity, Dr. Donner, to clear up any common misconceptions that you might hear from people about compassionate certification centers or the benefits or effects of marijuana in general. Do you have any of those to discuss or kind of clarify for folks?
Absolutely, and I'll start off more from the cannabis standpoint. I think just some general things for folks that maybe aren't patients or are considering it for whatever reason it may be. The first thing I just like to comment is from myself as a physician. So I've been an attending physician for over 10 years now, and when I got into medical cannabis, it was because of the research that I saw, and it was very interesting to me. What I have seen with medical cannabis over the last 4 years has been nothing less than profound. I have arguably seen cannabis help more patients than arguably any other medication maybe that I've seen outside of antibiotics. And I have seen some amazing things. I've seen autistic children communicate better. I've seen children who have hundreds of seizures a day get down to a few. I've seen folks who are on long-term opiates because of chronic pain get off of them completely. So I would encourage people to really look into things, to know that there is truly some science behind this, and is that as time moves on, there's going to be more of this that comes out there, and there's really people out there who can help them along these treatment plans. Piggybacking off of that, I think it's really important that patients know that just because you use medical marijuana or marijuana in general does not mean that you have to become intoxicated or stoned. That really, based off of the science, there's ways to control and modulate the components of cannabis so that we are able to administer these medications to patients without them having an intoxicating effect, which is really, really an important thing. I tell patients as well, it's important that they know that medical marijuana falls under all the privacy and protection rights of HIPAA, just like anything else in medicine. So it's important to remember that patients are oftentimes have a lot of trepidation or are very anxious about using medical marijuana because they're worried about other people knowing about that. I want them to know that this is protected health information, just like anything else. The final thing that people ask me about all the time, and one of the biggest reasons that patients will not get their medical marijuana certification is because they are worried about losing their ability to own their firearm or have a concealed weapon permit or that type of thing. I would like everyone to know that that's absolutely not the case, that if you have your medical marijuana card or you're a medical marijuana patient, this does not mean that your firearm is going to be taken. And Attorney Patrick Nightingale, who is a colleague colleague and a good friend of mine is really an expert on this issue. But I would hope people really look into that more, because I've seen so many folks who could benefit from medical cannabis but decided not to just because of that issue alone. So those would be some of the big points, Ryan, that I like to talk to people about sort of on a continuing basis.
Absolutely. That makes a lot of sense. There's a lot of rumor and conjecture and false information out there, and hopefully we can kind of dispel a little bit of that through this program today. So I appreciate you taking the time to join us. So much uncertainty in this time of COVID. It's difficult to anticipate the future, but what do you see as the future of compassionate certification centers or this field of medical study in general in say, like the next 5 to 10 years?
Another question I'm really glad that you asked. So I'll comment on the Compassionate Certification Center side specifically first. So one of the things that it's been really interesting to us that we've seen over time is that when we started Compassionate Certification Centers, it was really focused on medical cannabis more so than anything else. But what we have seen, and through our tens of thousands of patients, is that really medical cannabis is only one small part of healthcare, and that many patients are looking for alternative answers and need alternative support services as well. And sometimes maybe the traditional mode of healthcare or that traditional route has not worked out as they'd hoped. So one of the things where we see at least Compassionate Certification Centers moving in the future is offering a different array and variety of services to our patients that are outside of medical cannabis. So, for example, we just instituted that we have a naturopathic physician that's going to be working with us now so that our patients are able to meet with them and outline nutraceutical or nutritional routes to their wellness. We're also going to be incorporating a mental health division or a behavioral health division into our organization so that way CCC can not only offer our patients medical cannabis options for their PTSD, anxiety, whatever it may be, but we could also offer those additional support services as well. So for our organization, we really see ourselves in the future being more wide-ranged and broad spectrum than just medical cannabis focused. I think when you look at it on a global level or even on a national level, really the big changes are going to come with federal legislation changes, right? So when you look at marijuana now, federally it is still listed as a Schedule I substance. According to the government, that means that it has absolutely no medical applicability at all. We can say that this is not true, in my opinion now, with certainty, right? However, when the federal government changes those regulations, it's going to dramatically change the landscape for medical cannabis, and probably for the better. And what you will see when that happens is it start to get much more specific. There will be much more detailed research, and it will probably become much more incorporated into modern medicine, and I would say traditional pharma. So down in the future, that's really where I think you can see medical cannabis go. And honestly, we've really only scratch the surface of it and its utility in medicine.
Absolutely. Lots of possibilities out there. You're listening to Let's Talk on WISR 680 AM. I'm Ryan Saylor. Today I'm joined on the phone by Dr. Brian Donner, Chief Medical Officer and co-founder of Compassionate Certification Centers. If you could, Dr. Donner, talk for a few minutes about the social media presence of Compassionate Certification Centers. How does your organization utilize those tools to reach people, and what can people expect from CCC's social media platforms?
Our CEO, Melanie, has put together sort of a robust, not only marketing platform, but really across all of the social media platforms, and whether this is Facebook, LinkedIn, Twitter, and to the point where not only are we able to have our patients communicate with us during or through those platforms, but we're also able to communicate really prudent information out there to our patients through those platforms. So a wonderful example is this. Not too long ago, we did the first really large retrospective data analysis collection from a research standpoint on medical cannabis patients in Pennsylvania. And what we were able to do is through our social media platforms, we were able to reach out to not only our medical cannabis patients, but also other medical cannabis patients across the state, and then they were able to subsequently participate in that research program that we had. So social media, I think, in our case, is used not only for the traditional mechanisms, but I think also we use it from a clinical aspect as well to try to communicate information to our patients and to everybody else out there so that they have the most up-to-date information and that they know where to go for follow-up.
Absolutely. That makes a lot of sense. We've covered a lot of ground today, but is there anything else that you would like to let folks know about that's going on with compassionate certification centers?
I think one of the really neat things is that we, as our adjacent states here, start to incorporate medical cannabis. You'll likely see compassionate certification centers not only with offices in Pennsylvania, but in also other states as well. And so that may be something that's not only available in a brick and mortar fashion, but also through a telemedicine platform too. So I would tell people just that to keep their eyes out because we'll likely be expanding not only towards the eastern part of the state, but also into some of the other states as well. And also really for our patients and for everybody out there to please keep your eyes open for these new and additional services that we're going to be offering. These services are based off of patient need and really out of our patients coming to us and us trying to be able to fill the gaps. So we hope to, over the latter course of this year and then into 2021, really incorporate more of those new services into our platform.
The local Compassionate Certification Center's office is located here in Butler at 127 East Cunningham Street. I've definitely learned a lot today, Dr. Don. I very much appreciate it. I'm sure others have as well. Thank you so much for taking the time out of your busy schedule, talking with patients and helping folks to join us on the show today. I appreciate it.
I appreciate it too, Ryan. Thanks for the great questions, and you have a great day.
Thanks, you too. I'm Ryan Saylor. Have a great day, and we'll talk to you next time on Let's Talk.